Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, as Metro Manila and 4 nearby provinces shift back to stricter quarantine status, coronavirus cases in the country hit yet another record single-day high. After President Rodrigo Duterte heeds the call of medical frontliners for a timeout, what changes in the government's COVID-19 strategy can Filipinos expect? And later, while government scrambles to look for funds amid the COVID-19 pandemic, senators uncover alleged billions of pesos lost to corruption in the Philippine Health Insurance Corporation, or PhilHealth. Presidential spokesperson Roque joins us live. Another record spike in coronavirus cases in the country. This time, the health department reports over 6,000 new COVID infections to break the single-day record again on Tuesday. This is the fifth time in the past week that the Philippines broke its record for the single-day increase in cases. The country saw 5 consecutive record highs from July 3 to August 2. The latest increase also pushed the national tally past 112,000, with over 66,000 recoveries and more than 2,000 deaths. Despite the surge, government is ruling out an extension of the modified enhanced community quarantine in Metro Manila and 4 nearby provinces, at least for now. Let's go straight to the source of the story. We have presidential spokesperson Roque. Secretary Roque, thank you for your time and welcome to the show, sir.
Good morning, Pinky, and good morning, Philippines.
All right. 6,352 cases yesterday. Highest single-day increase. Secretary, what's happening?
Well, we're not alone. It's not as if it's just happening in the Philippines. No, there's been a report by Nikkei reporting that 70% of all countries in the world have reported spikes lately. No? Now, we have not confirmed whether this has happened in the Philippines, that there are reports that the virus has mutated and has become far more infectious than it was. No? But the important thing to note is that death or mortality rates remain to be very low. An overwhelming 98.5% of the cases continue to be asymptomatic or mild. So although there are deaths, we are keeping the deaths at a minimum. We're way within the threshold of 5% mortality rate considered as acceptable by the international community. We're at 2 point something right now as far as mortality rate is concerned. And of course, for the 1.5% that statistically could be afflicted with the disease in a critical manner, we are expanding our capacity to provide critical care. We're building more ICU beds. We have 250 beds coming up in Quirino Memorial Hospital. There's additional in East Avenue Medical Center, I should say, the 250-bed ICU. And then we have additional ICU beds coming up in Quirino, as well as in a couple of other hospitals. No? We're also building more isolation facilities because as we increase our actual testing capacity, and we have reached our target of 32,000 actual tests a day, there's of course a need to provide more isolation facilities for them, since unless they have their own rooms and own bathrooms, they will have to stay in isolation facilities, which is a lesson that they learned rather late in the day in Wuhan, no? Which we are now implementing through Oplan Kalinga. No? So we are taking steps to revitalize our T3. As I said, we're not stopping at the 32,000 actual tests that we have achieved. We are piloting what is known as pilot testing, where we can use one single kit for anywhere from 5 to 10 individuals. So that would exponentially increase our testing capacity, no? Not just 32, but minimum multiplied by 5 at least, no? 150,000. No? And with this increased testing capacity, it is also understandable that we have increased number of cases being reported, because that's precisely the reason why we want to test more, no? To find out where the virus is, isolate the virus, treat them, and trace. Now, as far as tracing is concerned, we're following the model of Baguio City under the leadership of Mayor Magalong. I had to sit down with him last Saturday to actually understand how it's done. But Pinky, it's very, very interesting. The rule of thumb in Baguio is every tracer will have to locate at least 30 to 37 close contacts of a COVID positive patient. All of the 30 to 27 are automatically subject to PCR test to find out if they have the disease. No? And they basically have geographical locations. So they only follow up on COVID positive patients within their area. And if there are individuals outside of their area,
Okay.
then they forward the information to their teammates operating in that area. No? So if we are able to implement this on a nationwide
There's so
basis,
much.
then I think we would be able eventually to curb the rise of incidents because we would be prolonging the case doubling rate of the disease as well as what is known as the R naught, or the number of individuals that a positive patient can infect.
From an infected person. All right, that's a lot, sir, that you said. I want to go into some of them. We talked about the pool testing before. 5 to 10 people or individuals in one test. Just a very quick question, sir. When will this happen? The pool testing.
I know that the pilot will start in Makati, no? It's supposed to start on the 6th, no? So I don't know if they have changed their timetable, but the pilot, after initial steps have been approved by the Philippine Society of Pathologists, will finally start on the 6th or thereabouts, no? Definitely within the first
Okay.
2 weeks of August.
Yeah. All right, because I think there is a meeting between Mayor Abby and probably Secretary Vince. If not yesterday, that will happen today on pool testing in Makati. Okay? So correct on that, sir. But beds in Quirino and East Avenue Center, sir. Well and good, we need beds because we are at danger or critical zone, sir. The problem is, sir, the manpower. Nasa na ho yung mga tao na magbabantay or the nurses, the healthcare workers that will man these hospitals, sir?
Well, initially, this is one of the two reasons why we have temporarily banned the working of nurses abroad because number one, we don't want to put them in harm's way when they go to areas with very high COVID cases. And number two, we may need them here. Number two, learning from the experience of Cebu, the DOH is now recruiting in areas with very low COVID cases, preferably around Metro Manila and the provinces that are under MECQ. No? But at the same time, I have read the DOH appealing for doctors and nurses from the Visayas and Mindanao to come help in Metro Manila for the time being, which was also what was done in Cebu. No? There was temporary hiring of health workers at the peak of the pandemic in Cebu City. No? So we're doing and adopting the same strategy for Metro Manila and the 4 provinces that are under MECQ as well. I understand that in addition to the usual pay, well, to begin with, most of the nurses will be working in private hospitals. No? And since it is the DOH that is employing them, whether be it temporarily or permanently, they will be enjoying the benefits of government health workers, which is substantially more compared to what private hospitals are paying them. No? So there's already a pay incentive there. And there's also other incentives being thrown their way, such as free accommodation, free testing, and free insurance.
Yeah, but when we talk about a recalibrated strategy, sir, something that the medical groups have wanted to be able to have a timeout, sir. The question really is how soon can this happen? I'm not sure, sir, if you were able to answer that question. I missed maybe the first 30 seconds of what you said. I didn't hear you, sir. So ang tanong ko ho, kailan ho sila darating?
Well, I think they're arriving as we speak now. Of course, they won't arrive at the same time, but we have had some success. I will give you the data as far as recruitment is concerned. I have no doubts that our health workers are amongst the most nationalistic and the most humanists of all professions. I think they will heed the call of the DOH to come work in Metro Manila for the time being. And as I said, the DOH has given them a package that is rather attractive, especially if you are a health professional, a nurse working for a private hospital outside of Metro Manila. I mean, the free accommodations by itself now makes the whole package very
You know,
attractive.
sir,
Yes, but I can give you the
actually, yeah, I
details
wanted to
later.
go
I
there, so
don't
it's
have the
free
details
accommodation for
now
them. I
on
think
how
I
many we
heard
have
Secretary.
recruited so far.
Yeah, okay, good, sir. Because I think Yusek Vergere was also saying in an interview earlier on ANC that she said that they're finalizing the number of health workers that they need today. So maybe we'll get that
Yes.
answer later on in the day. Sir, one more thing in relation to what you earlier said on my first question. You said contact tracers are very, very important, obviously. And according to Mayor Magalong, it's one contact tracer to 30 to 37 individuals. According to Yusek Vergere, we have so far 77,000 contact tracers, Secretary Roque, and we need 150,000. Don't we need that as soon as possible, sir?
We need that as soon as possible, but learning from the experience of Baguio, Mayor Magalong did not have to recruit additional personnel. He's using actually the PNP, no, for contact tracing, which is something that we will also implement here. The PNP leadership has signified their conforme to this, and they're in the process of training now the police officers that will act as contact tracers. No, the beauty in the Magalong formulation is while local government units can hire and pay for additional contract tracers, up to 150,000 of them, the police, because they're already employed by the government, can be tapped, no, to do the same chore without additional remuneration. That has been the experience of Baguio. So if you ask Mayor Magalong, he says that there should not be additional cost to contract tracing.
Mm-hmm. So, how many members of the PNP will be tapped as contact tracers?
Well, it really depends on how many they can afford to detail for this purpose. Now, again, I'm not sure about the figures, but the experience of Baguio is he did not have to go out of his way to actually designate policemen to do specifically contact tracing because he operates by way of how do you put that? He basically divided the cities into groups, no, into clusters, and the police who are working in the area anyway are told also
Yeah.
to perform contact tracing tasks. No? So they just operate within their geographical unit. They follow up on individuals who reside in their assigned area. And if in the course of talking to them, they happen to come across a name who had close contact with the person in a different area, they simply communicate this to their counterpart in that particular area, so that person can in turn do contact tracing on that other person. No? So I think on Friday, which is our next press briefing, we have no press briefing on Thursday, but it will be on Friday. We made a short video of Mayor Magalong's presentation, and I think it's important to show this to everyone, no? Because he has a
Mm-hmm.
rather simple, inexpensive way of performing contact tracing. But as I emphasized, one thing that I only learned from that Saturday meeting with Mayor Magalong is that anyone who was identified as having had close contact with the person is not just told to isolate. They're actually given a PCR test. And to him, to Mayor Magalong, that is, it's non-negotiable that all these who had close contact with a positive patient should be given PCR tests.
Okay.
And I think because we have now increased daily capacity
Just
for
two more
these tests,
questions
we
on
can
this,
do it.
sir.
We can do it.
Mm-mm. And if that is so, sir, itong 6,352, is this a cause for concern, sir? Or is this something, is this kind of number the number we should expect in the next days, sir? In the next coming days?
Well, as I said, Pinky, it's not just happening in the Philippines. Let's not have this wrong view that only the Philippines is having this many increase in cases. It's happening in 70% of the planet right now, no? And maybe it is because of the mutation of the virus also, no? But you know, I emphasize maybe because UP Genome Center has not confirmed that this mutated virus has actually landed in our shores, no? But in any case, we're not alone.
Mm.
Everyone will have to intensify their T3s. And there's no other strategy in dealing with COVID-19 other than intensifying your T3. And I think we are headed the right direction because we did not spare any expense. We opened as many labs as we could at unprecedented time. I'm very proud of the achievements of Sec Vince Dizon in this regard. I think we have the, um, the distinction of having opened the most labs in such a short period of time, from 1 to 90 plus now over a period of 5 months. And we're opening more, no, because we're not satisfied with the current testing. But that's key because as soon as we detect who are infected, then that is where we apply the invigorated tracing system of Mayor Magalong. And then we build more isolation facilities being built by the tracing SAR, Secretary Villar. And meanwhile, Yusek Vega, the treatment SAR, is operating the One Hospital Coordination Center, Command Center, the One Hospital Command Center, treating all the hospitals within Metro Manila and adjoining regions as one hospital for purposes of coordinating where patients can go for critical care.
So, because 70% of the countries are experiencing a spike, sir, it's almost as if my understanding from your answers that this was expected, this 6,352, sir, just to clarify that.
It's not expected, but it's being experienced by an overwhelming majority of countries worldwide. It's not just in the Philippines. Maybe it's in the disease. Now, overseas, they have confirmed that it has mutated.
Okay.
It has become far more infectious, 5 times more infectious. We don't know yet scientifically if it has come to our shores, but most
All
likely
right.
it has. It's a matter of time, perhaps, before the UP Genome Center can confirm it. But it's a reality that everyone in this planet will have to face. And despite what the political opposition says, as I said, no, it's not just in the Philippines where it's happening. It's worldwide.
We'll be taking a short break. Coming up, Secretary Roque and I will talk about the alleged widespread corruption at the Philippine Health Insurance Corporation. We'll be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, presidential spokesperson Harry Roque. All right, Secretary, there's a lot of reaction on this 70% of spike worldwide because we can also, again, compare ourselves to our neighboring countries. Right now, we are number 2, I believe, in Southeast Asia. Number 1 is Indonesia in terms of number infected. We are 1,000 behind from last I researched, sir. But anyway, I need to talk about other things. Rapid tests, Secretary Harry. Is this something government will still encourage? And is this something government will still implement? Because there is this perception, well, at least Dr. Dance of the Philippine Society of General Internal Medicine was saying that this should not be used as this could contribute or have contributed to the number of infections, sir.
Well, I think that's a personal opinion of Dr. Dance. Other doctors also support the use of rapid test kits in conjunction with PCR tests. So, in the Philippines, we have never encouraged RTK or rapid test kits as a standalone test. We always say that it should be used in conjunction with PCR, recognizing that PCRs are still the most accurate. I hesitate to call them as a gold standard because just like rapid test kits, there are now many cases of false positives registered using PCR tests, not because much of it depends on number one, the manner by which the specimen was collected, and number two, sometimes it's the incompatibility between testing kits and machines itself. No, I know of many high-profile individuals who had false positives also under PCR. So no test is perfect, and that's why you have to complement the use of PCR with rapid testing kits, especially in a country like the Philippines, where until recently we did not have enough tests. No, even if we have 32,000 tests per day now capability, the reality is not everyone can still get them. No, and the manner by which they're used by Project ARC, no, which is still in conjunction with PCR tests, I think should not be discouraged because it still produces the result that we want, which is to find out who amongst our population are afflicted with the disease. Now, I'd like to point out that yesterday the Department of Health came up with data on the clustering of COVID cases. And contrary to the claim of Dr. Danz, the clusterings were in the
Right.
community, in jails, and in hospitals. Now, who are using rapid test kits now? It's the
Mm-mm.
corporations. And there's no clusters observed in the workplaces right now. So it cannot be, no, that Dr. Dan said, that it is the use of rapid test kits are responsible for the widespread infections of COVID-19. No? On the contrary, the data of DOH will belie that conclusion. The data will support that perhaps rapid test kits are doing what they're supposed to do, which is operate as initial screening until individuals are able to get PCR tests.
Okay. All right. I need to shift topics, Sir PhilHealth. I know you have a lot to say about this. This is something we discussed even in the past. I think
Don't
even
get
in
me
June,
started, Pinky.
you were already calling out President Morales of PhilHealth. No, I have to get you started, sir. No, sir, we need to understand the situation. Let's look at what was said yesterday. Attorney Keith of the anti-fraud team of PhilHealth, former rather, said 15 billion pesos was stolen or misused by the mafia or PhilHealth executives. I wanted to ask you, is 15 billion, does this sound about right to you? Or do you think this is exaggerated or understated even?
Well, when we initially brought to the public's attention the WellMed scam, no, I was no longer spokesperson then. I was a private individual. We also had a source who said that for a period of time, PhilHealth lost about 174 billion, more or less. No, and that is why if you look at what Attorney Keith said, no, perhaps he's giving us an accurate estimate because he's not the only one who says that, no. And what is somehow making people believe Attorney Keith is he is an anti-fraud investigator. And initially, when he resigned, General Morales denied that he was an anti-fraud investigation, and it was as simple as showing his ID that he is in fact an anti-fraud investigator. No? And the initial attempt of General Morales to disclaim his employment as being an anti-fraud investigator, I think, is crucial because that established the credibility of Attorney Keith, and I think General Morales knew that as well. No? That's why he had to attempt to destroy his credibility by saying he had nothing to do with fraud investigation. So as someone who is familiar with the pattern of fraud perpetrated in the PhilHealth, I would say that's convincing because I had another source that said that more or less that's how much money is being lost annually.
15B.
Yes. And of course, even for accounting purposes, they recognize that there will be 2% wastage on fraud itself, no? And this is an accepted figure worldwide, no? But of course, the 15 billion has exceeded the 2% ceiling, no? Recognized by accountants worldwide.
Well, that's where I wanted to go. The president said, President Morales was saying that 10 billion lost in fraudulent claims in 2019. I was going to ask you that, is that even acceptable? Because if you ask, I'm sure, sir, all of us who pay our PhilHealth contributions, 10 billion is not something easy to digest, sir.
No, that's not something that we can digest, and we should never digest. We should never accept that even a single peso is lost through corruption, because precisely the law which I authored in the lower house, universal healthcare, will not be implemented correctly unless every single peso that the state invests in PhilHealth is used towards providing the people with free medicine and free healthcare. No? So every centavo counts. We cannot afford to lose 10 billion, not even 1 peso for that matter.
Yeah, but when there is such a statement, sir, that 10 billion pesos could have been lost in fraudulent claims, that's not, I guess that's just not acceptable. So,
It is not. And that's why my beef against General Morales is I have no evidence that he is corrupt himself. But when he was placed there by the president to replace a previous board and a previous president because of the WellMed scam, our expectation is he will take concrete steps to rid the agency of corruption.
yeah.
And
Yeah.
yesterday, what worried me was he admitted that corruption was still rampant,
Okay.
and I did not hear steps that he has taken, no, to remove corruption in the agency. That to me is the most worrisome.
All right. Okay. Secretary Roque, we need to take a very short break. We'll be right back. We're back on the source. I only have time for one more question. Secretary Roque, do you think General Morales should take a leave of absence or resign?
That's really up to him. No? I'm not in a position to tell him what to do. The president has said that he will not fire him unless there's evidence. And I think the Senate now is in the process of documenting this evidence. At the same time, there's also a parallel investigation being made conducted by Yusek Kitain. So it's his decision whether or not he wants to go on leave while these investigations are ongoing. But I'm just happy that two branches of government are investigating these allegations of fraud because, as I said, our universal healthcare law cannot succeed unless we rid PhilHealth of corruption.
All right. Okay, I have a follow-up question on that, but we don't have time. We're going to continue this discussion on Facebook. In the meantime, I'd like to thank, as usual, Secretary Harry Roque for joining us on The Source. Thank you, sir, and thank you for joining us here on The Source. I'm Pinky Webb. We'll be back on Facebook. Stay tuned for that.